Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. We're going to be speaking with returning guest Dr. Lawrence Edwards. He's joining us here as a rheumatologist to talk about some highlights from a recent roundtable discussion entitled Exploring the Link Between Gout and Renal Health. It includes some perspectives from several medical professionals and nonprofit organizations with expertise in gout and renal disease. Welcome back, Dr. Edwards. How have you been?
I've been well, Neil. It's always a pleasure to be here with you.
Thanks for returning. Give our listeners who may not be familiar with you as a contributor, give us a bit of your professional background. Of course, I mentioned that you are a rheumatologist. Talk about what it is that you do, and then let's talk about this roundtable discussion.
I'm a professor of medicine in the Division of Rheumatology at the University of Florida, but I'm also the CEO and president of a nonprofit organization, the Gout Education Society. The Gout Education Society is now in its 16th year of existence, and we've been out there on our website and through various other social media mechanisms to kind of inform the lay public initially about gout and what causes it and how we should think about it. And more recently, over the past 5 or 6 years, our website also has a medical professional side to it so that we keep doctors and nurses and PAs updated on what the latest breakthroughs are in gout treatment and the science behind gout.
Oh, what is gout and what causes it for those who may not be familiar?
Well, gout's the most common inflammatory form of arthritis. It's you hear a lot about rheumatoid arthritis and psoriatic arthritis on TV today, but gout is 4 times more common than either one of those combined, actually. It's very painful. It's part of a metabolic disease that usually begins in males in their 50s, sometimes 40s, and sometimes younger. In women, it starts a little bit later because they're protected by their estrogens, which enhances uric acid to be excreted by the kidneys. And so it's a disease in women after menopause. Uric acid is at the base of this disease. It's a metabolic breakdown product of our RNA and DNA and a lot of other cell materials. But it is tightly controlled. Its elimination is controlled by the kidney itself. So any disruption in kidney function greatly enhances the chance of somebody getting gout. And on the other side of the coin, anybody with gout has a much greater chance of getting significant kidney disease. So that was the reason for our coming together with the National Kidney Foundation and a number of our colleagues in nephrology, the kidney doctors, to have this discussion about the importance of recognizing and treating gout as a major risk factor for kidney disease.
Why is something such as gout that is so prevalent, as you say, why aren't we hearing much more about it if it's that prevalent, especially now that we're discovering this link between renal health and gout?
Certainly. But gout's had a very long history of being the kind of the laughable type of arthritic condition. No arthritis is laughable, and most of all gout, because it's by far the most painful and one of the most destructive forms of arthritis that there is. There's also a lot of misinformation about gout itself. If you go on the websites in general, you'll just be overwhelmed by the number of people that are offering diets for this disease. Elimination diets will make your disease better. But in truth, gout's a genetic disease. The genes that control the transport of uric acid by the kidney from the blood into the urine and elimination by that mechanism is the underlying basis for the majority of people that get gout. Everybody thinks that it's an overindulgence, that people that get gout have been eating too much, especially the wrong foods, or drinking too much alcohol. This is the perception that the lay public has about the disease, and in fact, the perception that a lot of medical professionals have. But in fact, genetics controls a good amount of how well we can eliminate uric acid from our body. And if you have kidney disease, that ability drops precipitously.
So there are treatments for gout. There are treatments, of course, for renal disease. How does treating both of them complicate both of those situations?
Yes. Well, the medications that we use to treat gout are of two classes. One are the anti-inflammatory mechanisms that decrease the severe pain that occurs during the flares of gout. Gout's a continuous disease, but what the patient feels is initially only intermittent, and its flares up. Throughout the whole time period, the patient is accumulating more and more uric acid in their body, and that's the underlying problem with gout. The diseases or the medications that we use to treat the flares of gout, like the non-steroidal anti-inflammatory drugs, the things that you see on your druggist counters like ibuprofen and naproxen, they all have a pretty negative effect on kidney function, and most nephrologists try and steer their patients clear of these drugs. Colchicine is another drug that's more specific for gout, but it also has problems in people with kidney disease. So our armamentarium for treating gout is more limited in patients with kidney disease. The other side of the treatment coin are drugs that can lower uric acid, and that's really the crux of getting this disease under control. And these medications include allopurinol and febuxostat, and for some patients, a more advanced drug called pegloticase. None of these drugs have problems with kidney disease, that they don't harm the kidney themselves, but there's a perception out there in the medical community and in the lay population that allopurinol and febuxostat and even pegloticase have some negative effect on kidney functions, but that's just not the case.
Does kidney disease equal gout 100% of the time?
No, about 70% of gout patients have significant chronic kidney disease. By significant, I mean class 3 on a class 1 to 5 scale, with 5 being dialysis level. So significant kidney disease occurs in about 70% of gout patients. And if you look at the patients with significant kidney disease, about a third of them will have gout. So it's a pretty large section of each group sharing the other disease. What we know from genetics now is that the regulators of uric acids in the body, these transport mechanisms within the kidney itself for removing uric acid, are mutated in the way that transport out of the body isn't as effective as it is in normal people or people with normal levels of uric acid. And so most patients with gout, they have about a 25 to 30% less efficiency in clearing uric acid. Mm-hmm. That's a genetically determined process. And people can have this without actually having kidney disease. So that's the genetic underpinnings. If you do other things, if you add other diseases on top of that, like diabetes and hypertension, cardiovascular disease, obesity, then that effect is much more impactful on the patient, and the uric acid levels go even higher.
You mentioned a website early in our conversation. Give our listeners that website where we can go and learn more about gout and the relationship between gout and renal health.
Sure, Neil. The Gout Education Society is online at www.gouteducation.org. On that, you'll find a lot of information about the gout disease itself. You'll also find a new white paper that came out of the most recent National Kidney Foundation's meeting, which just occurred last week. On it was a panel of gout experts, both rheumatologists and nephrologists, that discussed this important relationship between these two diseases. You'll also find a number of videos that discuss the role of diet. you'll find a number of helpful videos about how you can manage your lifestyle with this disease.
Well, I appreciate you, as always, coming by and sharing this information with us. I'm looking forward to our next conversation.
Always a pleasure, Neil. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. N. Lawrence Edwards. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.